cancer is different. My treatment is not the same as the next person's treatment. So when somebody says, what am I doing? What's my treatment regimen? I do not tell them because it may not be what they need. So we're going to hear your experience. Welcome.
Hi. Hello, everybody. Okay, so I have my little papers here that I kind of wrote down and deleted like 5 times and then rewrote them because she's right, I don't do public speaking. But Dr. D, Lauren had called, which Lauren needs a raise. And Kathy. But she called and was like, hey, Dr. D, really would like for you to speak about your experience. And I was like, well, yeah, of course. I'll do anything for Dr. D because she saved my life, literally. Besides my husband, who was filling me up when we were watching movies one night and said, what's that? And I was like, I don't know. And so that's basically how I ended up here. So, right there. And or complain for the rest of my life, go ahead. But in the beginning, let me go back to my notes. Okay, so next month will be 2 years since I was diagnosed with stage 2 triple negative breast cancer. Now, all we knew in the beginning, so my husband and my best friend, who is also my sister, dove this deep dive after I did my biopsy, and they went in researching, and they're like, all right, guys, we're great, we're good, as long as it's not triple negative. We've got HER2, we've got all these other things. And they're like, as long, I'm like, guys, let's wait. So we go to Dr. D's office. Now, Dr. D, you are just such a spitfire, and you are full of knowledge, which was a breath of fresh air. I cannot even emphasize that enough. When we sat in that room and we sat down and Kathy's popping her head in, she's like, and you're like, go do this, and then you're popping back in, but you're telling us all the things that we need to know, explaining exactly on your whiteboard, this is what's happening, this is what we're gonna do. And she looked at me, and she looked me dead in my eyes, and she said, you're gonna be okay. You're gonna be all right. When I say that gave me the power over the next 2 years, it wasn't about whether I actually was gonna be okay or not for the next 2 years. It was about the next day, you know what, tomorrow, I'm gonna be okay. Next week, I'm gonna be okay. In a month from now, I'm gonna be okay. Because when you get that diagnosis, my concern was not me. And that's something that so many people don't talk about. I think when I was thinking about this and I was going back and forth being, what am I gonna say? When you're a cancer patient, you're fine. I wasn't sick. When I was diagnosed. I was working, I was going on with my life. I'm taking care of my kids, you're fine. Then you get this diagnosis and it's like, the world doesn't stop because you find out you have cancer. And my concern was looking at my husband. But my husband and my children and my best friend and my friends and my family, and they are all terrified, and you see it in their face. So I was like, I'm gonna be fine. Even if it's just for a day, even if it's just for a week, I'm gonna be fine. And that was what I carried through the entire time. Honestly, Dr. D is the one. It's funny, I'm sorry I didn't get your name because no one was really, you were the first one to talk, so no one really, it was back to what you said at the beginning. And the network of doctors and people, because it was soulless at first. I'm sorry, I was so mad at that radiologist, because when I left, I was mad. She was telling me I had to come back for a biopsy. They came in early the week before Thanksgiving to make sure, because she was like, no, really, this is not good. I was mad. Now I've sent her a lot of gifts since then because she was right. But at the end of the day, she she saved my life too. Countless people, because all of you are in network with each other and you're communicating with each other and you are working with each other for us. And you don't know us. You don't even know me. You don't know that I have 3 kids and I'm going to soccer games and traveling. Like, you don't know any of those things. But the reality is, so there were a few points that I wanted to make. But the biggest one is for all of you that are working in this industry. Specifically, I have a love-hate with Medical City Dallas. When I drive up, for those of you that have gone through this, you understand. You see the buildings, you drive on 635, it's terrible. But whatever, you get here, and it's like, oh my gosh, I'm here again. But then you walk in, and you feel alive because of the network of people that are helping you. And I just stand here before, trying not to, okay, gonna get through this, I promise.
Okay.
Thank you. Because my oncologist, Dr. Krekow, had told me, because Texas Oncology, that's a whole other, they're amazing as well, that my tumor had not been there at max 4 months. 4 months, and I was stage 2. And now I stand here before you 100% cancer-free. And with that, there are countless people that come along for that journey, but because of you guys, I'm healed. Thank you. I love you more than you know. Of course, my family and my friends. For those of you that have cancer, a few things that I just want to mention. 1, you're never alone. Come find me afterwards. If you need someone to shave your head with you, if you need someone to tell you that wig looks bad, come let me know. No, I'm not even kidding. I'm not, seriously, like, y'all, I mean, it sounds funny, but like, when you are in a moment as a woman and you lose your hair and you are just wondering, does this look okay? Like, I have hairstylist friends that will cut your wig for free. So that's first. Second, you will find strength in places that you didn't know existed. Just watch for that. You will laugh again. And someday you'll look back and realize that cancer changed you, but it didn't define you. So you will go out of this and you will be a new person. And then sometimes the hardest chapters of our lives are just the ones that make us stronger, more compassionate, and more alive than we ever thought we could be. And so seize each day and be kind.
But not for you in life.
For you.
Some of you have noticed I'm an elbow bumper.